Hello, my name is Pat Bohse, and I'm really pleased to be with you today because we have a fabulous guest. With us is Joanne Bartosik, and she is the coordinator of volunteers for Senior Medicaid Patrol of New Jersey, which is a program under Jewish Family and Vocational Services out of Middlesex County. Welcome.
Thank you, Pat. Pat, thanks so much for inviting me. I really appreciate it.
And I'm really pleased that you're here, especially to talk about the issue on the table today, which is about scams and fraud, especially this time of the year. So before we get started, just tell me a little bit about how you've come to our table as far as your background.
Oh, absolutely. Formerly, I was in New York City, a manager for the New York City Department of Parks and Recreation. I came back to my home state of New Jersey, where I've worked for a number of nonprofits, but several years ago, I found myself at Jewish Family and Vocational Service of Middlesex County. And one of their programs is the Senior Medicare Patrol, and thanks to a capacity building grant, I was offered to come on board. And over the last 3 years, I have learned an awful lot about Medicare, Medicaid, fraud, waste, and abuse.
And that's a topic that everyone is so confused about. I mean, when we do classes here or we have presentations, we get a huge audience usually because they don't understand the rules. And then even if they do, the interpretation of them sometimes is a lot different than the implementation of them. So what I would love to spend some time on is, so tell us about what is the Senior Medicare Patrol of New Jersey. It sounds interesting.
It is interesting, and it's national.
Okay.
Senior Medicare Patrol is a federally funded program. There's a Senior Medicare Patrol in every state. The states, 54 in total: Washington, D.C., Guam, Puerto Rico, and the Virgin Islands. It just so happens in the state of New Jersey, Jewish Family and Vocational Service is the lucky nonprofit that received the grant about 9 years ago. It actually began in 1995 as a pilot program called Operation Restored Trust. And the key component of the program is to educate Medicare and Medicaid beneficiaries, their families and caregivers on health care fraud, waste, and abuse. It's an education program. It's a prevention program because we know it's much easier to prevent fraud and scams than it is to correct it.
Yeah, I'm sure we'll talk about some examples in regards to people being so-called ripped off one way or the other.
Absolutely.
The scope in regard to the Medicare fraud in the United States, I mean, we've heard so much about that on TV and you know, lots of issues in regards to the Congress about dealing with getting tough on people who provide or who defraud the government. So tell us a little bit about the fraud issues.
Well, the scope of it, I think what people are very shocked to learn is that this is an enormous financial issue. The FBI estimates that fraud, waste, and abuse in Medicare comes out to about $60 billion a year. And that doesn't factor in Medicaid or private health insurance. When you factor in all three of those, healthcare fraud, waste, and abuse is a $220 billion a year problem. The scope of it is enormous. And we all have a stake in protecting Medicare. We all have a stake in making sure that the Medicare Trust Fund remains strong for future generations. And we have paid into the system. We want it to remain healthy. So it's in everybody's best interest.
I'm just trying to think of those numbers. I can't put my arms around that.
It's staggering. It's really staggering. That actually comes down to 1 out of every 10 dollars spent on health care goes out the window to fraud, waste, and abuse. Enormous.
So how can people protect themselves from becoming a victim of fraud?
Well, there are many practical tips. The Senior Medicare Patrol message is protect, detect, and report. And the very first thing that everybody can do is to protect their Medicare number. That Medicare number is as precious as a credit card or your bank statement. People are often surprised when I say this, but you shouldn't be carrying your Medicare card in your wallet. There's no need to do that. I know people are very skittish about doing that. What if, God forbid, an emergency, I end up in the ER. you don't need your card immediately. And for those people that are really nervous about leaving home without it, I suggest that they actually photocopy the card, and they can actually X out the first couple of digits of the Social Security number. Most people know their Social Security number by heart. So that's one suggestion. Second is not to give that number out to anybody you don't trust. Medicare is not going to call you on the phone, and they're not going to knock on the door.
Can you say that again?
Medicare is not going to call you on the phone, and they are not going to knock on the door. And if they ever did call you on the phone, they have all of your personal information. They're not going to ask you to confirm your Medicare number.
Right.
The other thing that we're concerned about is mail and mailboxes. We don't want people leaving their mail overnight in mailboxes, and people that discard documents, please shred them. Dumpster diving is on the rise, and we really don't want people losing their identity through garbage that has not been shred.
And so that means that people, once you put your garbage out, they go through it.
Yes.
And if things are not shredded or cut up to very small pieces, they have the ability of getting the information, which is just, everything's there.
Absolutely. And if you think of maybe an assisted living community or adult 55, I mean, there are an awful lot of documents sitting in the dumpsters behind the building. So it's really imperative that people shred their documents. The other, and probably the hallmark of the program, wraps around the Medicare summary notice. The Medicare summary notice is that document that arrives in most people's homes every 3 months, and it is absolutely imperative that people read that document. That shows what Medicare has paid out for a Medicare beneficiary on their behalf, if they've been to a doctor, or if they've been to a lab, or if they've had any kind of procedure. Medicare gets an awful lot of bills daily, and if it looks reasonable and customary, they will pay it. So it really is it really is up to the Medicare beneficiary to be their own advocate and to read those statements. And if something isn't correct, they really do need to say something.
And I think that's really important because there's so much paper coming back and forth, and we do get lots of inquiries here about, so what does this mean, and what are they telling me? But some of the stuff is obvious that it's not theirs, and or someone is using their information, so they do need to be diligent about that.
Absolutely.
So if they find out or find something that is inappropriate in their estimation, what should they do?
The first line of defense is to call the doctor's office. Now, we tell Medicare beneficiaries, do not default to fraud, waste, and abuse. A lot of this is simply what we see is error. Maybe a code was put into the computer wrong. Maybe there are 2 patients that have similar last names. I received a phone call last year from a woman that received an MSN, and she was reading it.
English, MSN?
Medicare summary notice.
Thank you.
That's the document. And she was concerned because she saw that Medicare paid for a doctor's appointment from a doctor in Florida when she knew she was out of the country. I asked her if she called the doctor's office to ask about it, and she hadn't. I asked if she gave me permission, could I call the doctor's office on her behalf, and she said sure. So I called, and they were actually very, very thorough. I got right to the billing department where I was told, you know what, whoops, we have 2 patients with the same last name, same first initial on the first name, and it was a mistake, and within 2 weeks it was corrected. So a lot of this is error, but it still needs to be corrected.
Absolutely. So now with the Affordable Care Act, I mean, I think a lot of seniors are really confused about where do they fit in this. So maybe we have a couple of more minutes left. Maybe we can talk about that and what they should be aware of.
Absolutely. That's the question. We go out in the community and we do free educational sessions. And the #1 question we get is around the marketplace and the Affordable Care Act. Seniors on Medicare should not be on the marketplace. Medicare is their health insurance. Right. The marketplace was designed for individuals between the ages of 18 and 64 that do not have health insurance. As a matter of fact, it's illegal for anyone to knowingly sell a Medicare beneficiary a marketplace plan. So that's about the marketplace. But in terms of the Affordable Health Care Act, there are really some good provisions of the Act that improve, not diminish, Medicare. For example, there are now certain preventive services that are offered to Medicare beneficiaries without copays and without deductibles, such as colonoscopies, such as mammograms, and every year you get to see your primary care physician for a well visit. And these are really important improvements and provisions of the Medicare, the Affordable Care Act.
So if our audience wants more information or needs to talk to you, how can they get in touch with you?
They can get in touch with us by calling our phone number. If I have a personal health care journal here, which has our office number where they can contact us. People are more than welcome to call us either to schedule a free presentation. They can call us if they have any concerns about any billing issues that they might have, or for any information. We would be more than happy to be a referral source for everybody.
So we could probably talk for another 25 minutes, but time is up, so I really would like to thank you. And we will be working with you closely going forward in the future. And we will be right back after this short break.
Take it from me. Living with a chronic disease is no easy task, but I learned to better manage my health condition, and you can too. Take Control of Your Health is the chronic disease self-management program created by Stanford University. This fun, innovative course is now offered to all county residents. Diabetes, arthritis, heart disease, cancer. Take Control of Your Health gives proven strategies to manage these conditions and reclaim your life. See how nutrition, exercise, and various mind techniques can help you overcome depression, increase energy, and manage pain. You'll not only get this book when you participate, you'll also receive the guidance and support of others living with a chronic illness, just like you. Take control of your health in 6 short sessions.
Call the number on your screen to register or get further information at scannj.com. Brought to you by SCAN, Social Community Activities Network, with funding made available by the Monmouth County Office on Aging.
Hello, my name is Pat Bohse, and I am here talking to Andrea Tarr, the Program Director of SCAN. And on this segment of the show, we are going to discuss the new SCAN. SCAN standing for Community Service Activities Network. And we have a lot to talk about because 2013 had been an incredibly busy year for us, and as a result of that new experience for me and staff and volunteers and new employees, we are really excited about rolling out the new opportunities for all of our members in 2014. So with that said, I'm going to ask Andrea to give us a quick review of 2013, and I'll probably jump in.
Please jump in. Yeah, 2013 is a blur, and we did, as you said, we really accomplished a lot. I think some of the biggest things that happened was, of course, we really rolled out some of our signature programs, and that would be our Take Control of Your Health, and we'll talk a little more about that. Financial literacy for women and men too, and we're very, very involved in brain fitness, and that's kind of going to be our theme even going forward, right?
Yeah, and we will talk about that more, again, because we had this fabulous Total Brain Fitness Fair, and I think we were a little nervous about how that would go.
We were, but it went well. Well, first, I guess one of the big things that happened from 2013, yes, was it was our 20th anniversary year.
25th.
25th, what did I say? 25th, right.
You're having a good time, so you forgot a few years.
It was the year of the party. So all year long was really like a big party. We had a big birthday party up in the food court of the mall. That was wonderful. But most important, we had our Leaders of Distinction, our 25th anniversary Leaders of Distinction Awards luncheon at Seabrook. And that was just really a wonderful event.
And what made it very special for me, again, I'm the new kid on the block, so to speak, and I've not been here for a long time, but we were able to honor people or organizations who've been with us for 25 years.
25-year partners.
And I think that, you know, Monmouth Medical Center has been our major sponsor and partner for all of these years.
Right from the get-go.
And we absolutely appreciate what they do. We love partnering with them. We love setting up classes, educational classes that people can learn from their medical staff and also other kinds of programs that they provide. New Jersey Natural Gas, what can I say? I mean,
we can't say enough.
They just are a wonderful community partner, not only to us, but to the community, both in Monmouth and Ocean at large. And Tom Hayes, who happens to be our board president, has been, as far as I'm concerned, invaluable, especially to me during these 2 years. The Monmouth Mall, if they weren't our partner, we wouldn't be here.
That's
so they
true,
have provided us with this wonderful space and opportunity to bring classes to the community and also be an anchor here and available to people who are in need. The last but not least of our signature partners happens to be the Borough of Eatontown.
Yes.
We do have the Mayor of Eatontown on our board of directors, and he's been a true gift. He has, he's
been a great friend to SCAN.
Yeah, he's listened to us and he's helped us as much as he can. And we are in the Borough of Eatontown, so they've been with us from the inception. And again, we can't say thank you to the four of them enough. Of course, we have new sponsors who have joined us during the course of time, but they've been with us consistently. The new award that I'm really excited about is that we've kind of renamed our awards.
Yes, to make them more relevant.
And so we will be giving out the distinction in the field of aging, especially for people in Monmouth and Ocean County who have been providing services to seniors all of these years. And so we were able to give it to Community Service Inc. from Ocean County, and it was accepted by Jim Segerson. And I think the bigger issue in regards to that award, besides them providing Meals on Wheels services in Ocean for many, many years, is that they are now a new partner with us.
Yeah, that's
We're
wonderful.
expanding to Ocean.
We're moving, finally getting into Ocean big time.
And we'll be providing some services in Ocean County. And so that news is to come. We don't have that today.
Right, but they are a great organization to partner with, and you know what, they were so deserving of that very first award.
Yes, and so we were pleased to do that. The other volunteers is our own SCAN TV production crew.
Without them, we wouldn't be here talking to each other.
Exactly. So again, kudos and hats off.
Yeah.
And we hope that going forward we'll make lots of more I want to say music, but it's not music, pitches together. And again, grow the purpose of our shows that the community can enjoy them more at large. Last but not least, we have to thank Seabrook. They house us for this wonderful luncheon. That is one of their contributions to us. And this year we had over 160 attendees. And I have to tell you, the room was very diverse in regards to old friends and new friends. And I think everyone made that observation. And we gave out wonderful gifts, and that was due to Roberta Sheridan.
Roberta Sheridan came through big time. We had, I don't know, I think over 30, not just good gifts, but great gifts. Our table raffles were awesome. We had so many wonderful comments, rave reviews.
Yep, so we're really excited. So now that we're 25 years old,
we're young.
We're going to the next level. And so the other thing that we, again, first time was doing our Total Brain Health Fair last year. So talk a little bit about that.
Wow. Well, that's something that, we've talked about it for a long, long time, and we finally put it together. We had Dr. Cynthia Green of Memory Arts, that's her company, and she kind of spearheaded the whole thing for us. And Dr. Shira Goldberg from Monmouth Medical Center's Memory Institute, I believe, they were really like our keynotes. And we were worried about how would this be received. We did agonize quite a bit over this. But honestly, it turned into a fantastic event. We had about 120 people. And I think 15 interactive stations, each station some way of stimulating your brain.
Brain teasers.
Brain teasers, that's a good one. And again, rave reviews from the people that attended.
And some of the interactive stations are really giving us the groundwork for the classes that we'll be offering in 2014. So some of them were juggling, which I had some questions about when I first heard this, saying, so what are they juggling? But they did amazing. They juggled flags and scarves and a little more complicated things. It was a very active station. we made wonderful cards that, Thanksgiving cards.
Yes.
And we have sent them to Interfaith Neighbors, who was another partner of ours.
Which was wonderful to do.
Send out to the homebound
Yeah, I
seniors
love
who
that.
we've adopted during the year. And we will continue to work with them. The other was that Microsoft partnered with us and brought with them
that was kind of
10
amazing.
tablets, so we were able to do brain games.
Yeah.
And that was probably the most challenging station we had, but we will partner with them in 2014, both here and at their store in Freehold.
But the thing with the brain fitness is that we embrace mind, body, spirit. And so we did some, while we did, juggling and brain teasers, we also did meditation. And we did some yoga.
Chair yoga.
Chair yoga, that's right, chair yoga.
And we'll be introducing that in 2014 here.
Yeah.
And then we also had a pharmacist and a nutritionist from Monmouth Medical who really provided a lot of good information to the participants. And I think the biggest draw is that everyone had to visit 10 stations to be eligible for fabulous prizes.
Yet more prizes.
So my theory of free, cheap, and food absolutely saved the day again.
And I must say, our prize closet is gone. It's been totally depleted.
So anyone who wants to donate stuff to us, we're more than happy.
Call me, bring them in. I want them all. Yeah,
Yes.
we really came through with a lot of good things. And people were very generous, too. They donated a lot of things to us. That was wonderful.
Great.
Yeah.
So with all of that wonderful stuff behind us, we're now in
2014.
And we have some really good stuff planned. So why don't you kind of go over
Well, one of the
that?
things, of course, we'll have our campus of courses.
And no one knows what that means, so say that again.
I know. Let me start again. It's Boscov's campus of courses. And, of course, Boscov is one of the anchor stores in Monmouth Mall, and they've been a partner as well. And so they have on their 3rd floor a big secret. It's a giant auditorium. And SCAN is actually the ones that produce and provide everything for the campus of courses. And what this is, over the course of 4 weeks, we program anywhere from, 35 to 50 kind of one-and-done classes for people. They're either free or about $5.
Yeah, so and when last semester we had over 600 people come through our door.
We do get a nice crowd of people. I mean, we have everything from fun things. We have wellness components. We'll do meditation. Always gets a huge turnout. We have a lot of classes on digital photography. That always gets a big turnout. Something that gets a giant turnout is the one that we do on entitlements and benefits from the Office on Aging.
And we'll do that again.
We'll definitely do that again. And that's really, you might be the one looking for your own benefits and entitlements, but we also get kids of, their parents need the benefits, and most people really don't know where to go. And so that's been a very, very successful seminar that we have here. eBay also, that's another really hot one. Everybody wants to sell their, clean out their garage.
And I think one that we did last semester was the Antique Roadshow.
Wow.
Or a version of it.
A scan version of the Antique Roadshow. That was amazing. That's I didn't even know how to
we'll do it again.
Yeah, because that was wild. People came to that, Pat, with boxes. They didn't read my instructions of bringing one item. But people did have some actual treasures. A lot of it, there was fascinating stuff, but every so often there were probably a handful of people that had items that they unearthed that were worth thousands of dollars. That was really pretty amazing.
That's great.
Yeah. So we will do that again. That was a lot of fun.
And then we'll be carrying out the theme of the Brain Fitness Fair in a lot of the new programs that we provide.
Yes, because some of our classes are really going to be like officially designated as,
Brain Fit. With a little symbol in the catalog.
A little brain.
But SCAN has been providing brain fitness classes for 25 years. We've just never called it that.
No, that's really, that's been our mission for as long as we've been around.
And two other things that I just wanted to highlight is that we're going to be providing our members,
yes,
both new members and existing members, a new member benefit.
A fantastic member benefit, actually.
So explain.
Yes, and it has to do with the campus of courses. And as I said, most of those classes they're either free or $5. But if you are a SCAN member, you can take as many classes as you want to at the campus of courses for free.
Yep.
You want to take 1, you want to take 10, you want to go to them all free.
And some of those classes are morning, afternoon, or evening?
They're all different times of the day. We're even having one on Saturday.
And I'm excited about that, especially being able to offer that to our members.
Yeah, I think it's a great benefit. Yeah.
And then we'll have what's called theme months. Yes. And February, we'll be doing a whole theme around Valentine's Day. And I'm excited because it's my second favorite holiday. My first is Halloween. My second's Valentine's Day. So explain some things that we'll do.
We're going to call it more like Love and Appreciation Week. You know,
okay.
That's what we're going to bill it as. And we are going to have some special things. You know, we have a music class, a jazz class, and for Valentine's Week, he's going to play romantic music. So that'll be fun. And we are going to have a card making class for Valentine's, and you can make a card for your own excuse me, your own Valentine, or you can make one for somebody else. We're also going to do, I'm losing my voice, I'm sorry, we're doing a chocolate tasting. We've done that before.
That's your favorite?
That is one of my favorite things, so we will do that again. And we're also going to have a special session on, online dating, but a lot of it will be more about socialization when you're a senior. And we're also going to do something about feng shui and your love life. We did a class on feng shui before, but it was more geared towards your home. But this time we're going to gear it towards your love life.
So I think I should sign up for that one.
We should all sign up for that one, Pat.
So again, I'm really excited because we're already planning. We almost have the whole year scheduled.
Plotted out, yeah,
for 2014, which makes me very happy. My job is to make sure that we can do those. And the other wonderful thing that happened this year is we've gotten some additional employees. And they've been really very, very valuable. They come to us from a program called Workforce 55.
Yep.
And these are people who are over 55 and have incredible work backgrounds and are looking to get reemployed. And so we're providing an opportunity.
And it's been great because we've really needed some extra help. And this has been a great opportunity for us to get some really high-quality people, really wonderful people.
So we would like for anyone who's listening to this program to please make sure that they get to learn more about our programs in 2014. They can call us at 732-542-1326.
Yes.
They can visit our website at www.scanandj.com, or they can just come
for a visit.
The office, or campus, I should say, at the Monmouth Mall in the basement, next to the mall management office.
Yeah.
For a tour, we'd be more than happy to do that. Bring a friend.
And you can remind people, too, is that you can always try one class session for free.
Yep.
If you're not sure if it's going to be right for you, you can just come in one day, do the class, and make a decision.
So I want to thank you, and thank you for listening. Talk to you soon.
How to locate Scan. Scan is easy to locate once you find the movie theater at Monmouth Mall. As you enter the parking lot from Route 35, the theater is almost directly ahead of you. Drive towards the theater, but go up along the left side into the parking lot. As you approach the end, you will see entrance number 3 on your right. Park and enter the building here. Once inside, you will see a staircase that only goes down. After passing through the doors at the bottom, turn to your left, and Scan is right there.